Hello and welcome to this first video of the lesson, Introduction to Health Insurance. Here we will learn about the concept of healthcare in detail and evolution of health insurance in India. According to World Health Organization, health is a state of complete physical, mental, and social well-being and not merely the absence of disease. Let us now discuss the various determinants of health. First, lifestyle factors. These are mostly in the control of the individual concerned. For example, it is a good practice to exercise, eat healthy food, avoid stress, and bad habits such as smoking, drug abuse, unprotected sex, and sedentary lifestyle, etc. These bad habits lead to diseases such as cancer, AIDS, hypertension, and diabetes. Second, environmental factors. Safe drinking water, sanitation, and proper nutrition are very crucial to health. Negligence of these factors lead to serious health issues, especially in developing countries. Communicable diseases like influenza and chickenpox, etc., spread due to bad hygiene. Similarly, diseases like malaria and dengue spread due to bad environmental sanitation. Third, genetic factors. Diseases may get passed on from parents to children through genes. It results in differing health trends amongst the population spread across the globe based on race, geographical location, and even communities. Thank you. In this next video of the lesson, Introduction to Health Insurance, we will learn about different levels of healthcare. Here we will cover the following concepts. Healthcare is basically a set of services provided by various agencies and providers, including the government, to promote, maintain, monitor, and restore the health of the people. An effective healthcare service must be appropriate to the needs of the people, comprehensive, adequate, easily available, and affordable. The need to set up healthcare facilities in any area, whether a village or a district or a state, is generally based upon the various factors called healthcare indicators of that area, such as size of population, death rate, sickness rate, disability rate, social and mental health of the people, general nutritional status of the people, environmental factors such as if it is a mining area or an industrial area, and socioeconomic factors such as affordability. Based on these factors, the government decides upon setting up of centers for primary, secondary, and tertiary healthcare and takes other measures to make healthcare affordable and accessible to the population. Thank you. In this next video of the lesson, Introduction to Health Insurance, we will learn about the various types of healthcare solutions. Here we will cover the following concepts. First type of healthcare is primary healthcare, which refers to the first point of contact for all patients within a health system. Primary healthcare establishments also focus on preventive healthcare, vaccinations, awareness, medical counseling, etc., and refer the patient to the next level of specialists when required. At country level, primary healthcare centers are set up by government and private players. Government primary healthcare centers are established on the basis of the population size and are present right up to village level in some form or the other. Second type of healthcare is secondary healthcare, which refers to the healthcare services provided by medical specialists and other health professionals who generally do not have first contact with patient. It includes acute care requiring treatment for a short period, often as an inpatient, including intensive care services, ambulance facilities, pathology, diagnostic and other relevant medical services. Most of the times, patients are referred to the secondary care units which are available at the taluk or block level depending upon the population size. Third type of healthcare service is tertiary healthcare, which is a specialized consultative healthcare, usually for inpatients and on referral from primary or secondary care providers. The tertiary care providers are present mostly in the state capitals and a few at the district headquarters. For example, those who have advanced medical facilities and medical professionals beyond the scope of secondary healthcare providers like oncology, cancer treatment, organ transplant facilities, high-risk pregnancy specialists, etc. Thank you. In this next video of the lesson, Introduction to Health Insurance, we will learn about the factors that affect the health systems in India. Following are the factors that affect the health systems in India. First, demographic or population-related trends. India is the second largest populated country in the world, which exposes us to the problems associated with population growth. The level of poverty also has its effect on the people's ability to pay for medical care. Second, social trends. Increase in urbanization or rural to urban migration has posed challenges in providing healthcare. The move to a more sedentary lifestyle has led to newer types of diseases like diabetes and high blood pressure. Third, life expectancy. It refers to the expected number of years that a child born will survive. Though the expectancy has increased, but it does not address the issues related to the quality of that longer lifespan. This leads to a new concept of healthy life expectancy. This also requires the creation of infrastructure for geriatric, that is, old age-related diseases. Thank you. In this next video of the lesson, Introduction to Health Insurance, we will learn about the evolution of health insurance in India. Here we will cover the following concepts. Health insurance in India formally began with the beginning of the Employees' State Insurance Scheme. This scheme was introduced for blue-collar workers employed in the formal private sector and provides comprehensive health services through a network of its own dispensaries and hospitals. ESIC, or Employees State Insurance Corporation, is the implementing agency which runs its own hospitals and dispensaries and also contracts public or private providers wherever its own facilities are inadequate. The benefits covered include free comprehensive healthcare at ESIS facilities, maternity benefit, disability benefit, cash compensation for loss of wages due to sickness and survivorship, and funeral expenses in case of death of worker. The ESIS was soon followed by the Central Government Health Scheme, CGHS, which was introduced for the central government employees, including pensioners and their family members working in civilian jobs. It is partly funded by the employees and largely by the central government. The services are provided through CGHS's own dispensaries, polyclinics, and empaneled private hospitals. It covers all systems of medicine, emergency services in allopathic system, free drugs, pathology and radiology, domiciliary visits to seriously ill patients, and specialist consultations, etc. The contribution from employees is quite nominal, though progressively linked to the salary scale, that is ₹15 per month to ₹150 per month. This scheme has a membership base of over 800,000 families. In 1986, the first standardized health insurance product for individuals and their families was launched in the Indian market by all the 4 nationalized non-life insurance companies. The product Mediclaim was introduced to provide coverage for the hospitalization expenses up to a certain annual limit of indemnity, with certain exclusions such as maternity and pre-existing diseases. However, Even after undergoing several revisions, the hospitalization indemnity-based annual contract continues to be the most popular form of private health insurance in India, led by the current versions of Mediclaim. So popular is this product that private health insurance products are often termed by many people as Mediclaim covers. Today, more than 300 health insurance products are available in the Indian market. Thank you. In this next video of the lesson, Introduction to Health Insurance, we will learn about the market of health insurance. Here we will cover the following concepts. Let us first discuss about public health sector, which operates at the national level, state level, district level, and to a limited extent at the village level. Different levels are explained below. First, village level. To implement the national health policies in villages, community volunteers serve as a link between the village community and government infrastructure. These include Anganwadi, village health guides, and ASHA volunteers. Second, sub-centers. These have been established for every 5,000 population and are manned by a female health worker who is also known as the auxiliary nurse midwife or ANM, and a male health worker. Third, primary health centers. These are referral units for about 6 sub-centers that have been established for every 30,000 population. All PHCs provide outpatient services, but the majority keeps 4 to 6 inpatient beds too. Their staff comprises of 1 medical officer and 14 paramedical workers. Fourth, community health centers. These are the first referral units for 4 PHCs that also provide specialist care. According to the norms, each CHC would have at least 30 beds, 1 operation theatre, X-ray machine, labor room, and laboratory facilities, and should be staffed by at least 4 specialists supported by 21 paramedical and other staff. Fifth, rural hospitals. These include sub-district hospitals known as the sub-divisional or taluk hospitals or specialty hospitals. Sixth, specialty and teaching hospitals. These are fewer and include medical colleges and other tertiary referral centers. And seventh, other agencies. The agencies which belong to the government, such as hospitals and dispensaries of railways or defense, and similar large departments, also play a role in providing health services. However, their services are often restricted to the employees of the concerned organizations and their dependents. Second level of infrastructure is private sector providers. India has a very large private health sector providing all 3 types of healthcare services, that is primary, secondary, as well as tertiary. These range from voluntary and not-for-profit organizations to for-profit corporate, standalone specialist services, pharmacy shops, trusts, solo practitioners, diagnostic laboratories, and unqualified providers. It is estimated that more than 7,000 voluntary agencies are involved in health-related activities. India has a large pharmaceutical industry, which has grown from Rs 10 crore industry in 1950 to Rs 55,000 crore business today. It employs about 5 million people, with manufacturing taking place in over 6,000 units. The central level price regulator for the industry is the National Pharmaceuticals Pricing Authority or NPPA, while the pharma sector comes under the Ministry of Chemicals. Only a small number of drugs, say 76 out of the 500, are under price control, while the remaining drugs are under the free pricing regime, carefully watched by the price regulator. The drug controllers of the states manage the field force which oversees quality and pricing of drugs and formulations in their respective areas. Thank you. In this last video of the lesson, Introduction to Health Insurance, we will learn about some more concepts of health insurance market. One of the important categories of health insurance market is insurance providers. Insurance companies, especially in the general insurance sector, provide the bulk of health insurance services. A number of people and organizations providing services as part of the insurance industry also form part of the health insurance market. All such intermediaries are governed by IRDA. These include: first, insurance brokers, who represent the insurance-needy people and connect them to insurance companies, obtaining best possible insurance covers at best possible premium rates. Second, insurance agents, who are usually individuals, but some can be corporate agents too. Unlike brokers, agents cannot place insurance with any insurance company, but only with the company for which they have been granted an agency. Third, third-party administrators. They are not authorized to sell insurance, but provide administrative services to insurance companies. Once a health insurance policy is sold, the details of the insured person are shared with an appointed TPA, who then prepares the database and issues health cards to the insured persons. Fourth, insurance web aggregators. They are one of the newest types of service providers to be governed by the IRDAI regulations. Through their website and telemarketing, they can solicit insurance business through distance marketing without coming face-to-face with the prospect, and generate leads of interested prospects to insurers with whom they have an agreement. They also display products of such insurance companies for comparison. And fifth, insurance marketing firms, which are entities registered by the IRDA to solicit or procure insurance products, to undertake insurance service activities, and to distribute other financial products. Apart from all these categories, there are other important organizations in health insurance market, which include: first, Insurance Regulatory and Development Authority of India, or IRDAI. It is the insurance regulator and regulates all business and players in the insurance market. Second, General Insurance and Life Insurance Council. It makes recommendations to IRDAI to govern their respective life or general insurance business. Third, Insurance Information Bureau of India. It collects, analyzes, and creates various sector-level reports for the insurance sector to enable data-based and scientific decision-making, including pricing and framing of business strategies. Fourth, educational institutions. They provide a wide variety of insurance and management-related training, and host private training institutes which provide training to would-be agents such as Insurance Institute of India and National Insurance Academy. Fifth, medical practitioners. They assist insurance companies and TPAs in assessing health insurance risks of prospective clients during acceptance of risks, and also advise insurance companies in case of difficult claims. And sixth, legal entities. They play a role in the health insurance market when it comes to redressal of consumer grievances, such as the Insurance Ombudsman, consumer courts, and civil courts. Here is a quick look at the topics covered in this chapter. Thank you.